Well, I'm pleased to be sharing this with you and hope that you will be able to use the information that I offer. And I strongly encourage you to develop demonstration interviews in India. Uh, as I said last time, I don't know how to practice motivational interviewing in India, but you will. So what I'm doing is sharing what we have learned about motivational interviewing and and you'll be the ones who will be applying and adapting that in your own settings. So I mentioned before that there are 4 foundational tasks in motivational interviewing, and today we're talking about the first of those, which is the engaging task. It's done in a person-centered style, and really what the purpose is to establish an atmosphere of trust and safety. It doesn't have to take a long time. You can see it happening within a few minutes in demonstrations of motivational interviewing. But of course, it's an ongoing process. And so the skills that we'll be talking about today and next time from the engaging task are used all the way through motivational interviewing. They're foundational to the whole thing. What's happening in the engaging stage is listening to try to understand the other person's perspective and to see the world through their eyes. And these are foundational skills. So these are the things to learn first if you're interested in developing skillfulness in motivational interviewing. So we talk about 4 counseling skills or 4 communication skills that are part of the engaging task: open questions, affirming, reflective listening, and summarizing. And that will be what I'm talking about today. Asking open questions is the first of those 4. So the opposite of open questions is closed questions. And a closed question is one that really limits the person's response. They ask for a short answer, even maybe yes or no. Like a question, did you drink this week? Or did you have a good week this week, and so on. Or asking for a particular piece of information. What is your address? What did you have to eat this week? Just asking for particular kinds of information. Sometimes they can be multiple choice. You're proposing a series of possibilities. So with regard to substance use, what's your plan? Do you plan to quit? Do you plan to cut down? Do you plan to keep on smoking? And again, this can be used in any area in which you work. But essentially what's happening is that you're taking control with a closed question and limiting the kinds of response that the person can give you. An open question is more like opening the door. They don't suggest a short answer. They leave the person lots of room to decide how to respond, and you don't really know how they're going to respond. These are not questions to which you already know the answer or think you know the answer. So I'm just going to pose a series of examples and have you ask you, do you think this is an open question? Or do you think this is a closed question? So what brings you here today? What would you like to talk about today? Perhaps at the beginning of a consultation. That's an open question. Just invites the person to talk about whatever they're concerned about. Was your family religious? It's a yes or no question, and so it's a closed question. Tell me something about your drinking. What are the good things and the not so good things about it? Or about your diet, about the way you eat. What are the good things about the way in which you eat, and what are the less good things about how you are eating? Well, that's an open question. You don't really know what the person's going to say. So they're going to give you a broad range of information. If you did decide to quit smoking or to change your diet or to improve your relationship with your spouse, whatever it is, if you did decide to do that, how would you do it? How would you go about it, knowing what you know about yourself? It's an open question. When is your court date? Very specific piece of information. Don't you think it's time for a change? Not only is that a yes or no question, it's a rhetorical question to which the correct answer is obvious. So you're really limiting the person's responses. What do you think would be better for you, medication or counseling? Well, it's multiple choice question, so it's a closed question. What do you enjoy about cocaine? What do you enjoy about your relationship as it is now? What do you enjoy about the way in which you're eating now? So it's an open question. What do you already know about how alcohol affects an unborn child? Or whatever your area is, what do you already know about is a respectful question, an open question to ask people, in part so you don't tell them things that they already know. What do you already know about how this works? What do you already know about how it's important to change your diet when you have diabetes? Is this an open question? No, it's not. It's a yes or no question. So just a few guidelines about using questions when you're having conversations about change. And remember, that's what we're talking about. Motivational interviewing is a way of having conversations about change. All right. I find that most interviewers, most counselors just ask way too many questions. And in a way, the unspoken assumption underneath that, when you're asking a lot of questions, is once I have enough information, then I'll have the answer for you. Well, in some contexts, that's okay. In some contexts, that's correct. So again, if it's a problem that you can fix, if it's a problem you can do something about, if the person seems to have an infection and you're a physician and you're trying to find out what kind of infection it is, well, then asking questions is the right thing to do. But what you're talking about is a change in the person's behavior, a change in their lifestyle, then you need their expertise. And no matter how much information you gather, you're going to need that person's involvement and expertise, because you're talking about changes that only they can make in their lives. I suggest not putting a lot of questions together, not three in a row, for example. And when you ask questions, to ask more open than closed questions. Now, again, this is within the context of motivational interviewing, of a conversation about change. Listen well. I'm going to talk about reflective listening more today. And my suggestion is to offer 2 reflections for each question that you ask. So when you ask a question, you owe the person 2 reflections. And at the beginning of a contact with a person, at the beginning of a consultation, whatever your field, think that your primary task is engagement, not gathering information. Now, gathering information is important, but really your first task is engagement, is to develop a trusting and respectful mutual relationship. So those are open questions. What do we mean by affirming? Affirming is something that's easy to forget to do if you're very pathology focused. Training of psychologists often is training in all the things that can go wrong with people. And if that's your training, as you're listening to somebody, you're beginning to say, well, what's wrong with this person? What are the problems here? In a medical context, you may be looking for diseases or just things that are wrong with the person. Or in an educational situation, you're looking for, well, what does the person not know? What are the deficits that we need to correct here? Now, all of that is kind of looking for what's wrong, and affirming is looking for what's right. It's being sure to notice and affirm, to make positive comments on what the person is doing well, what's good about them, their strengths, about their intentions, about efforts that they've made, and particularly their strengths, particularly positive characteristics of the person. A phrase that my co-author Steve Rolnick uses is put on your strength glasses. Put on your glasses that are looking for the person's strengths, their good qualities, their positive traits, and then comment on those. Don't just sit there appreciating them quietly, but make a comment about them. Why would you do that? Well, it strengthens relationship. It also kind of decreases defensiveness, so it's easier for the person to be vulnerable with you, to share with you information that is a little scary, perhaps. And you're in expressing positive regard for the person, in affirming what's good about them, and it's a caring thing to do. And so again, it's building your working relationship with the people that you serve. Now, affirmation should be true. It's not something you're making up, and it should be genuine, something that you notice about the person. So it's a matter of being sure that you're noticing what the person's doing well, not just what's wrong. In our most recent edition, we distinguished between simple and complex affirmations. Simple affirmations are just commenting on something the person did, something the person said. So examples, that sounds like a good idea. Or thank you for getting here early today. Just so you're commenting on something rather specific. We distinguish these from complex affirmations because we think complex affirmations are more powerful. They have a bigger effect. And here you're commenting on not something the person did or said, so much as something enduring about the person, a strength they have, a positive quality they have. So that took real courage. You're commenting on the person's courage, on their willingness to be vulnerable, perhaps, to take a chance, to try hard. Or you care very much about your family. So those kinds of affirmations land particularly well, I think. People appreciate that you are noticing about them what their positive characteristics are. And this is the continuum. At one end, the simplest affirmations are very, very specific. At the other end are kind of profound statements that really appreciate something deeply personal and positive about the person. And in between is all sorts of gradations. But it's just remembering to do this, remembering to look for and comment on the positive. What we'll spend the most time on today, and we do in our writings, is the skill of reflective listening. It's been called accurate empathy by Carl Rogers, a psychologist who was working in the 1940s, 50s, and 60s. And empathy, of course, can mean many things. In a way, empathy is something that you develop when you're growing up. As a child, you begin to learn to put yourself in the other person's position and see things from their perspective, and that's important. You begin to feel with people. You maybe even have the same feeling that they're having, so you really are connecting with them in that regard. Empathy can mean identifying with the person. I know exactly how you feel. It can mean feeling sympathy or feeling sorry or just having a feeling about what the person is experiencing. None of those things are what Carl Rogers meant by accurate empathy. They may happen, but what Rogers meant by accurate empathy is a particular skill, a learnable skill, a measurable skill, one that has been studied extensively. And it's the ability to understand what someone is telling you, to get it right, from their perspective. So again, seeing the world from their perspective, and not just understanding it, but saying back to them what your understanding is. And that makes it possible for that understanding to become deeper. Your understanding and their understanding as well. Now, my first hint about how important this was in my own research came in 1980 at the University of New Mexico. And what we were doing is trying to help people with drinking problems, people who were drinking too much alcohol and it was causing them difficulties. It was harming their health. It was damaging their families, whatever. So that was where my career really began. And we were using a method called self-control training, teaching people how to manage their own behavior in their own lives. And so clients who were coming to our clinic looking for help with alcohol use disorders, we randomly assigned them to get 6 sessions of outpatient counseling based on self-control training, or 18 sessions of self-control training and some other behavior therapies that had to do with learning other life skills, or 1 session of encouragement, and we gave them a self-help book to take home and said, read it and follow the instructions in the book. And the book had the same material that we were using in the therapy. So it was about self-control, basically. So we randomly assigned people to get 6 sessions or 18 sessions, or just be sent home with a self-help book, which was sort of our control condition. We published that book in 1976. It's still in print under a different title. You can see how long ago this was. We went down to the Old Town section of Albuquerque, dressed up in old 19th century clothing, and had our photo taken. This actually is my staff who did this study. And I and 2 other people were the supervisors, and were observing the therapists via one-way mirrors. This was before we could afford video recording. And we had 9 therapists who were seeing patients and randomly assigning patients to them. We got surprising results. All of the groups substantially reduced their alcohol use, and there was no difference between these groups, depending on whether they got 6 sessions or 18 sessions or went home with a self-help book. And the only predictor that we could find of how well people would do was the therapist characteristics, specifically the extent to which the therapist was practicing accurate empathy while doing behavior therapy. Now, often training in behavior therapy is pretty structured. You do this, then you do this, and then you do this. But you can combine it with good listening. And this study told us it really matters if you do that. And we found that the better the therapist, the behavior therapist, the better the therapist was listening to the people they were trying to help, the less their clients were drinking. 6 months later, 12 months later, 2 years later. So the therapist's listening skills, their accurate empathy, predicted change, predicted client outcomes. We had 9 therapists that, as I told you, and we lined them up in order of skill and accurate empathy. So the 3 supervisors were observing them through one-way mirrors, and we were independently rating the extent to which they were listening well and reflecting back to clients their understanding. So this particular skill, in addition to whether they were doing the behavior therapy properly. What we found was the therapist that all of us rated as number 1, that all 3 of us said this was the most empathic of all of our counselors. 100% of their clients had good outcomes. At the other end of the spectrum, number 9, this therapist was not listening particularly well, was doing behavior therapy okay, but they just weren't listening well. And only 25% of their clients had a good outcome. And you can see that in between, there are all sorts of variations. Now, it's not a perfect correlation, but it's pretty good. It's pretty strong correlation that the more empathic the therapist, the better the behavior therapist listened to their client and showed accurate empathy, the more the client changed their drinking. Now, remember, we had a group that just went home with a self-help book. 60% of them had a good outcome also. And so if you average all 9 therapists together, the average outcome, the average success rate is 61%, which could lead you to say, well, therapists are not different from self-help books. But actually, that's not right. If you look here, we have 5 therapists whose outcomes are better than just working on your own with a self-help book. We got 1 therapist with the same success rate. And then we have 3 counselors here where it looks like the client would have been better off going home with a good book than talking to this counselor. Interesting. When you mix them all together, you get a kind of misleading 60% average outcome for therapists. Pretty powerful stuff. It was a very strong correlation. It was with that study that I went off to Norway, as I mentioned last time, with no idea about motivational interviewing. And it was in working with counselors there, social workers, clergy, psychologists, teaching them both behavior therapy and reflective listening. It was there that we came up with this idea of motivational interviewing. So I had in my mind this finding that listening really matters. There's a whole lot of evidence for that, as it turns out. So this skill of accurate empathy across many, many studies, counselors who have high levels of empathic skill, those who are high on accurate empathy, have clients who are more likely to change in a positive way, who are more likely to remain in treatment, to keep coming back. Clients who are less resistant, they're not less difficult to work with, and less likely to go back to the way they were before counseling started. This book on the right that we published in 2021 is a study I did with Terry Moyers. And we were interested in the fact that whatever your therapeutic approach, whatever your theory, whatever your profession, client outcomes are determined by, in part at least, the person who treated them. So who is your therapist? Who is your counselor? Who is your physician? Has a big impact on whether positive change happens or not. And so Dr. Moyers and I went back through 70 years of psychotherapy research, reading it and asking that question. What is it about counselors, or what is it about therapists whose clients are more likely to get better? And how are they different from therapists or counselors whose clients don't get better or even get worse, even though they seem to be doing the same treatment? So whatever the kind of treatment, client outcomes vary depending on who the therapist was. Well, among the things that we found, the strongest predictor of therapists who had good outcomes with their clients was empathic listening. This skill of accurate empathy had a strong effect overall in psychotherapy. Never mind the theory or the underlying school of psychotherapy. Overall, the biggest effect was how well the therapist was listening. So here's a little model from one of Carl Rogers' students named Thomas Gordon. And it's beautifully simple. Gordon said, whenever a speaker is about to say something, there's something that they mean. There's some experience they're having that they're trying to communicate. So that's their meaning. And then they put it into words and they say some words to you. And then you hear those words. And then you interpret what the meaning is. And I think most people, most of the time, assume that what they think the speaker meant is what the speaker actually meant. But in fact, there are 3 places it can go wrong, and we'll see that in a bit. If you look at this, there are 3 places where communication can go wrong. First one is people don't always say what they mean. And so when the speaker puts something into words, it may or may not be very close to what they actually meant to say. Then you have to hear the words. And as I get older, that's increasingly challenging. We're hearing aids. I may get it wrong in that regard. maybe you're listening to someone with a different accent or a different language. So you may not even hear the words correctly. And then you have to figure out what the words that you think you heard actually mean. And so you're privately making a guess about what it is that the person was intending to communicate. And so that red box on the lower right is 3 steps removed from the place where it started on the yellow box on the lower left. What can you do about that? A solution is reflection, is this reflective listening process that I'm going to be talking about and giving you a chance to practice shortly. How does that work? Reflections are statements rather than questions. So what we were just doing is asking a question. Is this what you mean? Do you mean that? And so forth. Reflections do make a guess about what the person means, but you're not really asking it as a question. Reflective statements will usually get more information than just flat out questions do, yield better understanding. And usually you can turn a question into a reflection. Now, well, why not just ask questions? And see if this makes sense to you. I don't know how you do this in your own language, but what's the difference between a statement and a question in your own language? In English, of course, there were words that mark it as a question, but then also there's what you do with your voice. And often in English, a question, you hear the voice kind of turn up at the end. You're angry with your mother, which is different from the same words as a statement. You're angry with your mother. Now, these two things land a little differently typically. You're angry with your mother? In English, almost communicates you shouldn't be feeling that way. Or the listener is surprised that that's what you're saying. Whereas just a flat statement, you're angry with your mother, just helps the person keep talking, keep going. Another example. Imagine you're talking to a teenager. You don't see anything wrong with what you did, or you don't see anything wrong with what you did. Questions are somehow just a little more of a challenge. They demand a response, but it also is just making the person feel like maybe they shouldn't have said that, or you're disapproving, or there's something else going on there that you don't really intend, probably. And if you just make it as a statement, it doesn't have that extra baggage with it. One more. You're feeling kind of anxious. The person may feel anxious just because you're asking the question that way. You're feeling kind of anxious? Well, I hadn't thought about it, but maybe I am. Or you're feeling kind of anxious. It's a little safer to respond to the statement than to the question, and there's less baggage attached. And so I encourage people to make their reflections as statements. Now, if you watch me counseling, now and again, I will turn a reflection into a question, and it's not a huge mistake if you do that, but it just has a different impact. And asking things as a question sometimes will communicate something you don't intend to. So how do you turn a question into a reflection? You can think a question, first of all, like the question we were asking before. Do you mean that you're a physically fit person? But you get rid of the words at the beginning that make it a question. Do you, are you, would you, what? So those are markers that a question is coming. And then when you get to the end, and this is again an English language example, when you get to the end, you turn your voice down. So instead of saying, do you mean you're physically fit? You can get rid of the do you mean. You're physically fit, but it's still a question because of the music and the voice. You're someone who's physically fit. It's a statement. Now you got yourself a reflection. It's still making a guess about what the person meant. And by the way, you don't need to have any apologetic prefacing statements like what I hear you saying. Sometimes American counselors are taught to say that, and it gets old really quickly. And of course, you're the person who's hearing it because you're the only person in the room. So you don't need to give any kind of preface or apology. You can just make it as a statement. Now, until you get used to this, it can feel strange. In part because you know you're guessing. You know that what you're guessing may not be right. And so that kind of makes you want to ask it as a question, but asking it as a question can be a little threatening or have these other effects. So try it out as making a statement instead of asking a question. For example, if the speaker says to you, I'm an adventuresome person. Now you can offer a simple reflection that doesn't make much of a guess, just doesn't add much of anything to what the person said. A simple reflection could be, you're adventuresome, And actually sometimes that will help the person keep talking and give you some more. Or you enjoy adventures. It's still not much of a guess, A complex reflection is one that makes a little more of a guess. Maybe says something the person hasn't quite said yet. So they make a guess about the meaning that's there, but hasn't been directly said. You can be rephrasing what the person said. You can find a metaphor. You can reflect the feeling that you're hearing. I'll go into those things in more detail, continuing the paragraph. So just a couple of examples. To someone who says, something you should know about me is I'm adventuresome. You could say, it's fun for you when you don't know what's going to happen. Now that's a guess, and it might be what they mean. It might not be what they mean. Or you're someone who's willing to take risks. It might be what they mean. It might not be what they mean. What if you guess wrong? What if you say you're someone who's willing to take risks, and that's not quite what they meant? What they'll say is, no, it's not that. And they'll tell you a little more of what they do mean. So actually, there's no penalty for getting it wrong. There's no penalty for missing here. Even if your guess is not correct, the person will still tell you some more. And at some level, appreciate the fact that you're trying to understand them.